then I'm going to start webinar. Are you happy? Happy with me to start it now?
Yeah, let's go for it.
Okay. Okay, so it says once you click start, attendees can join this webinar. So at the minute or so for more people to join. Shall we get started, Asad? Shall we
Yeah,
get cracking?
let's go for it.
Okay, great stuff. So hello everyone. Thank you very much for joining our webinar tonight. So I'm Jack Lovett from Pearl. I'm based in London. And Pearl provides AI detections for dental x-rays, and we have been doing so since 2019. So to introduce you to our speaker tonight, Dr. Asad Rahman qualified from the University of Leeds in 2015. Since then, he's gone on to study from 4 different universities, undertaking postgraduate education in dental sedation, restorative dentistry, endodontics, and most recently a master's in business administration. So Asad is currently the clinical director at GenSmile Dental, where he sits on the board to ensure that all their 38 clinics across the UK are providing the highest standard of care of clinical care across the UK, whilst remaining at the forefront of dental innovation. So clinically, his practice is limited to endodontics, and he will still work in the clinic 2 to 3 times a month. As Asad will also explain, AI in general, and specifically us, Pearl AI, how it's been crucial to his clinical work throughout the past few years. Outside of dentistry, Asad is also involved in the world of sports, where, as director of operations for the Scandinavian stock listed company Ascenta Group, this is really cool, by the way, he has helped to develop and implement the strategy around growing sports of paddle in the UK and Ireland. So we definitely have to get a game under our belts there, Asad, if you're
Yeah,
up for the
definitely.
challenge. Now, before we start, if you have any questions, please pop them in the chat, and we'll go through them at the end of the webinar. And hopefully, we do get through most of them anyway. But we'll go through that. So yeah, without further ado, I'm delighted that Asad can join us tonight. So I'll hand it over to the man himself, Dr. Asad Rahman. Over to you.
Thank you. Thank you for the kind introduction, Jack, and thank you and hello everyone joining. I'm delighted so many of you could join us tonight. So, as Jack mentioned, I've been a dentist now for 10 years, and I like to think in that time I've kept myself busy, enhanced my career in this ever-changing dental world that we're all part of. And I suppose when I reflect back to my career to date, there were three real moments which have caused a huge shift in my working life and pattern. Firstly, was when I decided to, after spending thousands on postgraduate education in restorative dentistry and sedation, I decided that the only thing I really liked was endodontics. And so, as Jack mentioned, I decided to practice limited endodontics, and I realized I then had to spend thousands more on doing some further training, which went down well with my family at the time. Secondly, was when I started my first non-clinical role at a previous dental group. And having worked as an associate my whole life, I suddenly realized that a dental practice has to make money for us as associates to sit there and offer the best treatments in the world and the best care in the world. So that was a real eye-opening thing, kind of obvious thing, but real eye-opening thing to see it from the other side, the business side of dentistry. And thirdly was a particular week a few years ago when I was in my first year of my MBA and I was doing my module in AI. And at the same sort of time, I was introduced to Dr. Carl Stanley, who's a prominent dentist in the States. Some of you may know of him. And he was a real kind of early champion of Pearl and all things, and still is all things AI and digital. And that was a real kind of hard-hitting moment for me where I was able to see with my own eyes, not just the technologies and endless possibilities of AI in the world as I was learning on my MBA, but then also the direct kind of implementation of it with a company that was already at the forefront in dentistry. So I've done some loose kind of aims for tonight's webinar that we'll look at, but I hope we'll cover a lot more than that. So very simply, we'll kind of look at understanding how AI can streamline diagnostic accuracy and clinical decision making within multi-location dental groups. So when we have that appreciation, how can it support us as clinicians? Secondly, we'll look at identifying practical applications of AI, and a lot of the things I touch on tonight, a lot of the applications are already out there. So often I kind of go to these talks and learn a lot on AI. You may see things in the out there where people often talk about futuristic, a Black Mirror type style of world where things may be coming down the line, but all the companies and all the products I touch on tonight are already out there. A lot of them I'm utilizing, a lot of them maybe you're already utilizing, but it's about how we can fit that into our workflows. And then finally, I'll touch on kind of my day job, my non-clinical role, where I've helped implement AI across groups of practices, across groups of clinicians, and really how it can benefit us and be an adjunct to us as clinicians. So always like to start whenever I talk about AI with some definitions. Now, artificial intelligence refers to the simulation of human intelligence by machines, particularly computer systems. So in simple terms, it's about getting computers to perform tasks that typically require human intelligence, such as problem solving, learning from data, decision making, etc. Now, AI comes in different forms. So the kind that we see in healthcare a lot at the moment and a lot of the applications is narrow AI. Essentially, this means that it's AI designed for it to perform a specific task, like interpreting radiographs with Pearl, which we'll touch on. It doesn't mean that it's kind of an advanced theoretical concept where AI can perform cognitive tasks. We're not there just quite yet, especially in healthcare. It's also important to remember and clear up some misconceptions. AI is not conscious, it's not self-aware, it doesn't think for itself, and crucially, it's not infallible, so it will make mistakes. And AI systems are only as good as the information and data that we input into them, and it's important that we have that kind of understanding at this moment in time as well. So, what is out there? Like I said, I'll start off by touching on some of the products which you're all probably using at home. And these, as time passes, will just more and more kind of implement into our daily lives. And then when I touch on dentistry and healthcare in a moment, you'll realize why it's important that we also follow suit in dentistry. So Google Maps, for example, already using AI to give us the best routes, real-time traffic data, making sure we get use the fastest route. OpenAI, the company behind products such as ChatGPT, which I'm sure you've all used, and I'll show a fun application of this in a minute. I mean, I use ChatGPT daily, as a lot of you already do, but I'll show a fun application of this that I used a little while back. Netflix uses AI to personalize our viewer preferences, Amazon for preferences. So you can see really just becoming a part of our day-to-day lives. And I mentioned on kind of a fun example, I'm sure some of you used ChatGPT like this, but a little while back, my son, I've got a 6-year-old son, he was bored over his holidays, and he wanted to do an escape room, and within minutes ChatGPT was able to give me riddles suitable for a 6-year-old at home, and I was able to make him a little escape room around the house. And something which just would have taken me hours to do myself, wouldn't have been as entertaining, but with the technology out there, it's amazing what we can do. So coming on to healthcare, what are the kind of the wide-ranging uses? Well, again, AI is revolutionizing healthcare. So as time passes, we're going to end up with a point where we're going to be able to predict and prevent disease outbreaks. So we all went through that time in COVID, and nowadays the World Health Organization uses AI tools to predict epidemiological models and monitor the spread of infectious diseases. So hopefully preventing, or at least at best predicting, a future outbreak earlier. As time passes, we'll also get to the point where drug treatments will become personalized, and medical treatments in general become personalized. So again, the care that we'll receive for our health will be optimized for us, again using AI data throughout the previous trials and medical trials that have been done for years and years. And an interesting one I read is that our NHS is also starting to use AI to optimize resource allocation and monitor kind of hospital beds and waiting times. And I always make a joke about this, but next time when we're in A&E and we're having to wait 18 hours, well, it's not the fault of a hospital manager, it's now AI's fault because they've mismanaged the resources there. So again, amazing to see the other applications, and I'll touch on some of these at the end with what we can do in dentistry, especially if you're part of a big group. So coming on to dentistry, there's 5 kind of real areas where I believe AI will make a massive change. And we'll touch on each of these individually. So firstly, diagnostics and patient communication, record keeping, treatment planning, predictive analysis, and robotics. I'll touch on that right at the end. And again, I'll share some real world examples for all these kind of products that are out there already. So coming on to diagnostics and communications, patient communication, for me, there's only one real kind of product which is leading the way, and that's Pearl AI, a system I use every time I'm in practice. I've used for a couple of years now. Essentially, AI, and Jack will be doing a demo in a few moments' time, uses deep learning algorithms, uses AI data from having analysed hundreds and thousands of X-rays, probably more than that now, Jack, as time's passing, and can identify conditions such as caries, bone loss, periapical lesions to such a high degree of accuracy that in some studies it's been shown to outperform humans, also providing us with faster and more accurate assessments. So you may be thinking, well, why is that important? Well, as I touched on a few moments ago, because AI is implementing into our daily lives, and we're all using it in our daily lives, patients are also expecting dentistry to follow suit. So this recent survey of 1,000 dental patients in the US found that 63% are uncertain if the dentist is reading the X-rays accurately. And are we surprised there? Again, I always think there's the old adage, if you show an X-ray to 10 different dentists, you'll get 10 different treatment plans. And it's no surprise that patients are picking up on this, where we're looking at shades of grey and everyone's kind of giving them different opinions. They could be showing their friends who are in the dental field and they're getting different opinions. So without AI, we're kind of not gaining the patient's trust that we could be gaining by utilising AI. 55% would feel more confident if their dentist verified their x-rays, and 82% would prefer the dentist to use the most advanced technology and AI technology if possible. And again, they probably don't even realize that there is this technology out there now. But with Pearl AI, it's amazing what we can do. And I'll show some examples in a few moments of where it really helps me in my day-to-day role. But that survey, clear as day feedback from our very own patients that they want dentistry to evolve and uptake AI. So to touch on Pearl more specifically, and the few general benefits that I and many other users around the world find. Firstly, as I touched on, the enhanced accuracy in diagnosis. So after years and years of postgraduate education, years as a dentist, I really thought that I wouldn't or shouldn't miss anything when looking at radiographs. And we're all human, and we know that's just not the case. I mean, my variability changes in times of day as well. Every dentist will say this, whether you're first thing in the morning, getting close to lunch when you're a bit more hungry, your diagnostic variability just changes. And AI, specifically Pearl AI, prevents that. We're also able to detect caries and pathology a lot sooner and a lot earlier. And again, it's extremely beneficial in preventing disease, preventing even restorative care, because we're able to tell patients about early carious lesions, which they can then monitor and improve their oral health. Thirdly, streamlined workflows. So I'll hand over to Jack at this point because he'll explain how important and how amazing Pearl AI can be in terms of streamlining and entering your workflows. So I'll stop sharing my screen there, Jack.
Okay, thank you. Great stuff so far, Asad. Okay, can you see my screen okay, Asad? Is that showing?
Yep, all on screen there.
Perfect. Okay. So what we're doing, we are looking at all 2D imagery. So you've got your bite wings, PAs, OPGs, panos. And what you'll see here are these little circles here. This is where it gets exciting in terms of reading radiographs now. So when we click on this image here, what the AI is doing is it's instantly highlighting our attention towards the talking points or the important parts of that radiograph you're looking at. So what we're looking out for our AI is all these pathogens on the right hand side here. So you've got calculus, very good for bringing hygienists into that conversation. Same bone levels here as well, and highlighting the severity. And if you look closely here as well, we're also showing to 100th of a millimeter the distance between the cranial junction and the bone crest. We also show caries, and when you hover over it, we're also showing you how far the decay is going into the tooth. And you'll see the two different colors here. So we have incipient lesions and obviously the progressed caries here. So where this works very well as well is if you have a perhaps a remineralization product, it's very good to talk to the patient about that. Or you could say to them, we've seen this, etc. We can keep an eye on that. We also show periapical radiolucency here as well. So again, where Asad mentioned, we can have times where we can be busy, tired, distracted, creating pirate games for our 6-year-old kids and, maybe miss things. So the AI is here to essentially be that assistant to you, that second set of eyes. Again, we might be very drawn towards this, whereas you might miss the caries here on the upper right six. So it's working very well as that clinical point of view for you, being that assistant. Where it also comes in incredibly well is for that patient communication. Again, as Asad mentioned there, that when you're showing patients this grey, black and white X-ray, oftentimes they're just nodding at you and smiling, and that they don't understand what you're pointing at, which is often when we have to get the pen and paper out and draw an incredibly bad picture of a tooth. Whereas now what we're able to do is click on the tooth parts right here and now make it abundantly clear to the patient exactly what you are seeing and why you want to put X, Y, and Z in their treatment plan. So just to give an example here, we can say, okay, we've seen this. This is the decay, this little pink splodge here. It's going through your enamel, the hard bit of the tooth, into the dentine, this green area here, the more sensitive area. So this is why we want to do X, Y, and Z. So again, it's just making that communication line much, much clearer for them. So essentially, the AI is here to be an assistant tool for you and an educational and communication tool for your patients. So yeah, back over to you, Asad.
Thank you, Jack. I'll just reshare my screen there. I think you can all see that there. Brilliant. So thank you for that, Jack, because it's always good at that point for everyone, especially people who are new to Pearl AI, to actually see the system in progress before I jump into some examples. So Jack's done a really nice job of showing the system, but let's dive into some real life, real world examples where Pearl AI has saved me. So, as Jack mentioned, my practice is nowadays limited to endodontics. A lot of these cases are endo related. However, some of them, because I've been using Pearl AI for a while, are for patients when I was still doing some general dentistry. So, here's a case of a 49-year-old patient who presented to me complaining of discomfort on her right hand side. She'd seen a couple of previous dentists. No one was really able to pinpoint kind of the reason to her pain. Now, these radiographs were taken by her GDP, who had referred her to me. And because they couldn't seem to get a diagnosis, they had no real working diagnosis, and they were questioning the upper right 8-7 region, which on first glance, a lot of you may also be doing. So I took a detailed history, and as is classic in these kind of circumstances, it came back inconclusive. So the patient was describing sharp pain lasting for minutes, occasional painkiller use, not worsened particularly by hot or cold, sweet, not worsened particularly by eating, just inconclusive kind of mixed signals. Upon examination, a relatively healthy diagnosis, conducted special tests, came back normal to sensibility testing, no TTP, top right, lower right, radiographs. So because I had Pearl AI at the time, I was able to put these X-rays into my computer system, put them into Pearl AI, and we were able to showcase straight away caries on the upper right 6. And crucially, the point here is no PA pathology was highlighted, which again did match with some of the special tests I conducted, and extremely useful and conclusive. So this patient, after seeing 2-3 dentists, now, because I'm able to show them this and get a diagnosis of reversible pulpitis upper right 6, where we can simply restore the upper right 6, resolve their issues, but they're confident in our diagnosis. So a nice simple case to start off with there, but perfectly highlights how when patients are questioning diagnosis, when we're sometimes questioning our own diagnosis, in modern dentistry we now have this tool available to use. Second example, this is a 13-year-old patient, new patient to the practice, who'd visited the dentist every 6 months. And the patient and the mother's kind of almost presenting complaint was that every time they visited the dentist, they needed another filling. They'd never had any x-rays before. So first thing obviously I do, my whole digital AI workflow, give the patient exceptional experience, clinical photographs, x-rays, intraoral images, and then sit down to discuss with the patient. Now, bear in mind, I've just said that their presenting complaint is almost that every time they visit the dentist, the reason that they're looking for a new dentist is they're almost looking for someone to back them up and say they don't need any fillings. Well, what do the x-rays show? Even without Pearl AI, some of these are quite obvious. But how do we explain that to the patient? And how am I going to gain their trust simply by showing them black and white images? Well, not an issue with Pearl AI because I can quickly highlight everything on the screen. Now, the best thing here, as Jack was touching on, because of the depth perceptions that Pearl AI can give, and it can clear as day, show that the caries on the lower right 7, for example, is larger, then we can easily explain to the patient why we're making clinical decisions. So, for example, the upper left 6, why we're going to be monitoring that, lower left 7, why we're going to be monitoring that with a fissure sealant, the lower left 5, why we're going to be monitoring that for maybe a little while, because again, it's within the enamel. So you can now start to explain to patients the depth of the caries, but also the treatment decisions that you're going to make for them. You can also explain the lower right 7, for example, there's no way we can monitor that. The caries lesion is just too large, probably need some follow-up radiographs there in terms of a PA. but you're able to explain why that restoration will also be close to the pulp and why in the future there may be post-operative complications. You're also able to explain the upper right 7 as well, for example, where you can see a previous restoration's been done and there's some slight caries underneath. Well, you can potentially explain that the dentist is looking to maybe preserve the pulp there, preserve some leave some caries at the base of the cavity, and then restore occlusally. So now you can not only show the caries, gain, effective consent, but also gain effective consent for the treatment that you're proposing. So next example, this is going to be an endo example. Patient was referred to me for endo on the lower right 5. Pretty obvious. Sensibility testing, TTP showed, and also the PA pathology shows up on the X-ray. The lower right 6 was responsive as normal. This patient was referred to me for the endo of lower right 6 and lower right 5. So after doing my test, the special test on the lower right 6, it was responsive as normal. No TTP, vital. How am I going to explain to the patient that their dentist potentially has got the diagnosis slightly wrong and they only need one endo? The lower right 6 could be restored. How am I also going to kind of liaise with the dentist and explain that? Well, again, Pearl AI clearly highlights PA pathology on the 5, caries lesions larger on the 5, extending to the pulp. The 6, we can see the extent of the caries lesion, and we can easily show them it's far away from the pulp, so they're able to gain that understanding on the treatment that we're proposing. So we go ahead, fill the 5, and then refer back to the dentist to restore the 6. Again, providing the correct treatment the patient needs, utilizing AI. Next example, here's a case where there's an obvious issue on the upper left 5, and actually this patient presented having not been to the dentist for many years, and this restoration that you see here is actually a restoration they did themselves by using a kit from a pharmacy. We all know those kits that they can get and they kind of just thumb a filling into their tooth. And surprisingly, it lasted for a long while until it started causing them some pain, so they decided to come and get some dental treatment. Well, first of all, again, I'm able to gain their trust, show them the PA pathology, show them that they need a root canal, but also, interestingly, I'm able to show them the differences in the bone levels and the fact that because they've done some DIY dentistry at home, they've left an overhanging margin, which has obviously been trapping food, and they've had some bone loss distal to the 5. So again, I'm able to show the kind of the damage that they've caused and the potential future issues they may even have now relating to the 6, for example, which would have otherwise been a perfectly healthy tooth because of the treatment that they've done. So we go ahead, restore, do the endo on the 5, restore, and again off to a dentist to provide a crown there. So again, nice and easy example to show where Pearl AI kind of comes into its own in explaining treatments and diagnoses to patients. And here's the final example I'll go on before I touch on other things. This is a patient this time around was referred for end of the lower right 5. And when I do my special tests and take X-rays, I'm able to see there's PA pathology on the 6 as well. So this time, how am I explaining to a patient who's coming in, been referred to me for one endo and a crown, that they now need 2 endos and 2 crowns? Well, again, Pearl AI easily highlights it there on the right-hand side, shows the level of caries extending to the pulp, shows the PA pathology, and the patient is able to gain the patient's trust with the treatment plan. So again, we go ahead, do the endo in both the 5 and 6, and then back to the dentist for the crown. So some great examples there of where I utilize Pearl AI day to day, explain diagnosis to patients, gaining patients' trust with treatment plans, and this is obviously focused solely on an endo and restorative, but there's a whole host of applications out there in terms of explaining periodontal treatments, bone loss, part of which I touched on there. So we'll move on. If you remember a few moments back, I'd said there's 5 things I'd touch on where I feel AI will change dentistry. And the second of these things is record keeping. So again, I'll explain some brief examples of companies that either I use or are out there for you all to use. I'll only touch on these very briefly, but in terms of record keeping, the product that I have used before is Koroku. So again, Koroku, I'm sure some of you have come across this system out there, allows you to personalize your records utilizing AI. Nowadays, you can even use your voice to record patient notes, and within seconds, it develops your notes, which are fully CQC compliant, far more contemporaneous than we would do using a template, and far more accurate because they're utilizing our verbal cues. So again, an example of a product that's out there where you can utilize straight away from tomorrow in terms of implementing this into your workflows. And the other point I want to mention here is if you are a dentist that's forward thinking and starting to use these technologies in your day-to-day life, what effect do you think that will have on your patient base? Well, they won't have often seen things like this before. So they'll straight away be able to realize that you're at the forefront of dentistry and providing a different standard of care to them. And implementing these in your workflows will definitely change your career. And again, we'll touch on some of the metrics that we can see when people start to implement AI into their daily lives in a few moments. Next aspect in terms of treatment planning, a company that I've come across here, utilized a couple of times before, is Chairside, where they use AI tools to develop videos. So Pearl AI gives you the view on your x-rays, allows your patients to see your view on the x-ray in terms of diagnosis and explain the treatment. Chairside will allow you to send them 3D videos using AI technologies for them to view and understand the treatment that they're going to be accepting. And again, when you utilize this, it will completely change the way that you're able to communicate with patients and completely change the way your workflow and your new patient journey in specific works. Moving on to predictive analysis, there's companies such as dental monitoring. And this is an interesting one because orthodontics for years and years has kind of, I know if there's any orthodontists watching, they might come back to me on this, but has kind of been the same principles. With dental monitoring, we've got the opportunity now to change the patient journey, whereby if we're providing aligned systems to patients, they're having to come and see the orthodontist far less, and often that can be a big barrier to patients uptaking orthodontic treatments, any longer term orthodontic treatments. So with dental monitoring, utilizing AI tools, patients are able to take images off their treatment, send it to their dentist or orthodontist, and have fewer visits. So it completely changes their patient journey. And for me, technologies like this, where they're using AI to predict your diagnoses and allow dentists to view images whilst patients are in the comfort of their own home, have the potential to really change dentistry. Because are we going to get to a time in the future where patients are doing this as part of a pre-checkup, and then when they come into the dental practice, their journey throughout the dental practice is a lot smoother. They're able to obtain the treatment that they require a lot faster. So this is a really exciting one using orthodontics, but I really see the application of predictive analysis in a lot of aspects of dentistry as time passes. So I'll deliberately paused in the 5th aspect of robotics because I'll touch on that at the end. And I want to start delving into AI at an organization level, and AI from my perspective, where in my role as clinical director of a dental group, how we can implement these technologies into our daily practices, into our workflows. There's a few kind of things to focus on here. The main thing for me is that we live in a complex, litigious world. We also live in a world where dentists, as clinicians, we're self-employed. And I certainly wouldn't want a technology being implemented or imposed on me. So what we're going to touch on over the next few moments is if you are part of a dental practice or a dental group or an owner, how you can utilize AI and bring your clinicians on a journey with you to implement these newer technologies in a way where you'll get a massively different and improved uptake to their use. And obviously, this is Jack's day job, trying to help clinicians uptake Pearl AI, for example. And I'm sure he'll have some thoughts to share on this at the end. So at GenSmile, we're happy to say that we'll be partnering with Pearl across 3 sites to run a pilot phase over the coming months. Now, as I mentioned, it's important that we bring our clinicians on this journey with us. And having implemented Pearl AI and similar AI technologies across large dental groups before, I know that pilot phases are the way to go. And you may also, even if you have one practice, you may want a pilot phase amongst a few clinicians where you feel you can utilize those clinicians to trial this new technology. And once they're comfortable with it, they can almost become champions to try to expand it across your practice or your group of practices. So that's why we've gone with this 3-phase approach. We'll have a pilot phase for 3 sites. We'll then go on to a cohort, step 2, where there's a cohort 1, where we'll have 10 additional sites. And by step 3, we're hoping all remaining sites come on board with Pearl. So I touched on a few of the reasons why we've gone with that approach. And apart from the obvious that, as I mentioned, I've seen a pilot phase work before, what are the specifics that we're looking for in terms of our criteria if you're part of a large dental group, and what's kind of sites Pearl AI is best to be implemented on? Well, firstly, we're looking at a mix of sites. So 2 of the sites that we'll be trialing are specialist-only referral centres. At GenSmile, we're proud to have 5 specialist-only referral centres across the group. And we feel the specialists in this practice will really give, in a funny sort of way, Jack a hard time and really trial Pearl AI to the maximum and give us feedback on the system. The 3rd site that we'll be using is a large general dental practice site, a 13-chair site, where we have a mix of general dentists and incoming special interest and specialist dentists. And again, we feel it's good to compare the sites between a specialist site and a general dental practice site. Secondly, we want a few practicalities in there. So we want to make sure we've got sites where there's sufficient internet speeds so that Pearl AI can be utilized to maximum, and where there's practice management systems. I know Jack didn't touch on this earlier, but systems like SOE Dentally are great for Pearl AI, really seamlessly embeds into the system. So we've gone with 3 of our sites that have these in place. So what are we trying to track when we look at Pearl AI, and what are we hoping to kind of achieve throughout the trial period and then hopefully expanding? Well, very simply, we want our treatment conversion rates to go up. We want to see, does Pearl AI help that? Hint, it does, and I'll touch on that in a few moments. I've seen it before, I've seen it with myself. Secondly, we want to see, does the treatment value for new patient treatment plans increase? And then some softer metrics. We want feedback from our clinicians, from our patients, because as I touched on at the start, it's important our clinicians are fully on board with this system if we are to implement it across the estate. So as I touched on, what are we hoping for after 12 months and after a trial period, and what have I seen before? Well, I've seen, having implemented this across a large dental group before, implemented Pearl AI, we found that there's always an increased treatment acceptance rate, and I'll touch on some of the numbers on this in a minute. We also found standardized clinical outcomes are better. Some practices ended up with high double-figure increases in revenue, and this was compared to the 12-month directly prior to the practice having Pearl AI. Now, I can't go on specific numbers, and it's not fair to share numbers when from a group perspective when we talk about these things, but I'll share my own example. In the time that I started to use Pearl AI, my role in my previous job was changing. So I was doing more and more non-clinical work and less clinical work. So I was having to change from 3.5 days in practice to 2 days. And as time passed, I was able to see completely no change in my income now working on 2 days because the treatment acceptance of my patients was far greater utilizing Pearl AI. And these were patients I'd serviced, I'd seen them for 3, 4 years. I felt I'd gained their trust, they trusted me. But that final little piece was missing where they were able to almost independently verify treatment utilizing AI and the treatments I was proposing. Now that they could see it, they were going for that treatment. So a massive benefit to my own personal career. And I said I'd touch on some numbers, and these are numbers that Pearl AI themselves have from across the world implementing Pearl AI. You can see some of the figures there. Percentage of fillings, acceptance for fillings goes up 19%. That's always a real interesting one for me. Scaling root planing goes up 37%. Again, another interesting one because these are treatments which patients have always needed. But why are they holding off on these treatments? It's simply because do they not trust the dentist? Do they not trust the treatment being proposed? Well, with Pearl AI, as we said, it completely takes that out of the way. Look at some of the other figures. Implants goes up 18%. If you're a practice owner and your implants go up even 5% year on year, you're delighted. And look at some of those figures. So all of a sudden, you're serving your patient base from a completely different clinical perspective, providing them the treatment that they need, and they're accepting it. And then on top of that, you're also benefiting financially. So absolutely incredible what it can do. I suppose I'll turn on my light, Jack. I wasn't expecting it to go dark so soon. Just realised I'm sitting in the dark there. Um, so to move on, I thought as we're wrapping up close to the end, and as Jack touched on, if there are any questions, I'd be happy to take some questions at the end. I wanted to touch on AI at an organization level and the responsibility that we all have when implementing AI. Now, it's a new technology, and there's always kind of scaremongering in the press in terms of where are we heading, are robots coming in, and I'll touch on that in a few minutes. But just in terms of newer technologies, I feel the main things that we have to all bear in mind is we have to keep our patients' data, and our fellow professionals safe. So the term responsible AI has actually been coined, and it involves considering the impact of AI on people and society, and it's about creating AI technologies that are aligned with human values. So if we are to implement AI as time passes in healthcare and dentistry in specific, we must do so in line with the ethical principles set out by the GDC. And as I mentioned before, ensuring patients are safe and gaining their trust by being transparent about how their data is being used. And if we focus on those three things, I think we won't go too far wrong, but only time will tell what the future holds. And talking of the future, and this is where I'll kind of wrap up tonight, and this is getting really innovative. You may have seen last year this news story came out where a robot dentist completed the first dental procedure from the point of anesthetizing a patient, preparing cavity, filling the cavity. And the first question I had when I saw this, and I'm sure some of you are having, is what's the UDA rate and what's the UDA target for a robot dentist? I mean, wouldn't it be incredible if robots were just working across the country? Obviously, I'm joking, but it would certainly help to solve the NHS dental crisis we're all facing. Now, this robot dentist was developed by a US-based company called Perceptive, who are backed by a dentist called Dr. Ed Zuckerberg. And as the surname gives away, he's the father of Meta founder, Mark Zuckerberg. So you can see we're not too far off from robots being implemented into dentistry. So the question is then what happens to the dental workforce? Well, unlike other industries, where AI may entirely replace certain careers as time passes, recent surveys in the US have found that dentistry is very low down on the list of careers, which could be entirely replaced by AI. And I mean, are we surprised there? Even out of us as dental professionals, will want a robot dentist to do a filling, even if we could say it's going to provide a far greater accuracy, we still want that human connection. We still want that empathy from a human dentist. And ultimately, the goal, and to wrap up tonight, ultimately the goal of AI should be to use it as an adjunct to improve our case acceptance, to detect disease early, to show patients and gain their trust, obtain more valid consent, and free up us as clinicians to spend more time with patients and less time on admin. And if we think about technology in that way, if we're responsible with AI as we implement it throughout dentistry, then we won't go too far wrong. Thank you very much for listening, and I'll stop sharing and hand back to Jack.
Fantastic. Thank you so much for that, Sad. That was super insightful. Love the figures that you were able to present as well. And one thing I didn't touch on, well, two things I didn't touch on during that demo was the fact that we had that seamless integration with Exact and Dentally Vision AI, as you mentioned, but also the time-saving element of it all. The fact that you are able to clearly explain to the patients exactly what's going on, it can save lots of time in terms of getting that pen and paper out and trying to draw a rubbish picture of a tooth. So we do have one question here, which is probably a good sign because it meant that you were very detailed in your webinar there. So got through most things. But I don't know if you can see it here, Asad, but it says,
Yes, again,
as an endo, how do you balance Bite Wings, I guess, AI product like Pearl versus CBCT? I think that's a really good question, actually.
Yeah, I was probably going to bat that back to you because, as we know, Pearl AI at the moment is on 2D radiographs. So, utilizing it for 2D radiographs, PAs, bite wings, as I've shown tonight, it's not just there, and OPGs as well, but it's not just there yet on 3D imaging such as CBCTs. But we're getting close, I believe, Jack.
We are indeed. I always like to be careful about when we say it's ready. But yeah, so actually I'm going to refrain. I'm going to really hold back from trying to say that. We have our team working on it. We believe it's ready, but then as you also touched on there, said about the responsible AI, you have to get all sorts of approvals, whether it be GDPR, FDA, CE mark, MDR, which we do have, of course, for 2D. So we're just going about obtaining that for 3D.
Yeah,
As to when it's ready, I don't know. If you're going to really, really push me, I would say sort of maybe second quarter next year. So
okay.
yeah, that's all to come as well. So second opinion is just one of many products Pearl has, but it's as Sad has spoken about there, it's super helpful for both internal and external with patients.
Yeah. So I mean, yeah, just to maybe answer that question in a different way as well. So when I'm doing endo CBCTs for certain cases, or from in my mind, are indicators if there's any retreatment I want to do. If there's something I can't visualize on a 2D image, then obviously I'll get a CBCT. And the whole point there is, this is getting very technical on endo now, but the more, you can't have enough information before you start a case, especially if it's a referral case for a retreatment, for example. The more information you have, the better. And again, that's where Pearl AI helps with that.
Yeah. I also like this comment, this question as well. Hi Asad, and this is from Anonymous as well, probably a good thing to put yourself like that. So hi Asad, I'm part of Gen Smile and looking forward to having this implemented. How quickly do you think to push it? Are you also going to support us with internal training?
This is a great question on internal training because again I'll pass over to Jack in a minute. But yes, so on a wider point of view, I know it's anonymous who shared that, but if you want to reach out to me, then we can discuss it. Like I said, there's no set time frame on it at the moment. We want to do this trial phase first. We want, like I said, it's important we bring our clinicians in those sites along. It's important we get some champions across those sites, apart from just myself, and then we can then it becomes a lot easier to implement it across other sites. So if everything goes to plan, we'd be talking months, not years, but we have to see how the pilot phase goes, etc. In terms of internal training, I'll touch on my example, then hand over to Jack. But it's another reason why we've chosen Pearl AI. There are other radiograph systems out there doing similar sorts of things. In my opinion, not as good as the quality that Pearl AI gives, even in terms of imaging, etc. But the best piece is the support that Jack and his team will give. So our teams are going to have kind of one-to-one support, lots of training, not just from myself, but mainly from the Pearl team. And if there are any teething issues, I personally, again, hand on heart, had never had any teething issues, but I knew if there were teething issues, I could reach out to Jack and his team straight away to improve that. But do you want to touch on that more as well, Jack?
Yeah, absolutely. And we put a big effort and a big push in expanding the UK team here. So we brought many people on board, and so there's always that support on our hours as opposed to US hours or European hours perhaps. And so we provide that training, just giving you best practices of how it's worked in other clinics. But we do also like to be specific to the certain groups that they're working with. So as said, as you know, we had our deep dive session, as we call it, where we like to really understand the group, what you're about, perhaps where you found difficulties, and then tailor our training to how we would do that training with your clinicians. But honestly, I couldn't think of anyone better for doing internal training than you, Asad. You've obviously gone through it today in terms of how you speak with your patients and how you utilize it to work alongside it. So yeah, I'm excited for this sponsorship we have with Gen Smile.
Definitely. Yeah.
Yeah, I think that's it in terms of questions. Um, but so then I guess all that's left to do is give you a massive thanks again, Asad. Honestly, that was truly insightful, and I hope all the attendees found that helpful. And of course, if you have any further questions, you can reach out to either Asad or myself. It's just jack@hellopearl.com, and I'll be happy to take any questions of yours. And yeah, we look forward to hearing from you.
Thanks, Jack. Thanks, everyone. Take
Thank
care.
you, everyone. Bye bye.